Many patients suffer from sinusitis. Doctor, how does balloon sinuplasty help this condition?
Essentially, sinuses are big spaces in your skull, and they empty via little tiny slits into your nose. So if you get very frequent sinus infections, sometimes scar tissue actually forms at that opening, and we need to open up those openings so things can appropriately drain. In the traditional approach, and it's all done endoscopically, which is through the nose, I go in and make large openings into the sinuses. This is for people who have very chronic disease. For people whose disease is not as extensive, but they're still suffering, there's an alternative, and it is called balloon sinuplasty. So instead of ripping out and removing those tissues, I use the pressure of a balloon, which expands, to open up those sinuses. So I pass a light into the sinus before the balloon, and it verifies the location. So it's really nice because there's a couple of sinuses that we really don't have a good view when we're doing endoscopic sinus surgery. The cheek sinuses and the ones between the eyes, these are called maxillaries, these are called ethmoids, are very easy to see, but the frontal sinus, which is up here above the eyebrow, it's in a recess, so you have to go up and kind of curl around, and in certain people, if their anatomy is not good, it's hard to really assess and know that you have a really nice, good opening. So this is the first technology, and I've spoken with other surgeons who do this technology. It gives us a nice satisfaction that we've adequately done our job and opened things up because of what a good view it is. In addition, there's another sinus called the sphenoid sinus, which is in a little bit of a more dangerous area, and you can safely go in. You're not ripping out tissue. You're not potentially in a risky area because there's big blood vessels and other things in that vicinity, and you're gently just expanding and opening, and again you have a nice good view that you're right inside.
Who is a candidate for this procedure?
It's for people who have chronic sinusitis, people who don't have nasal polyps, which are growths, because that needs to be physically removed, people who have frequent infections but probably not as often as, say, other people. It is a great technique for people who don't have a lot of downtime. The traditional sinus surgery is about 10 days of downtime depending on your pain threshold. And for balloon sinuplasty, I have some patients within a couple of days that they recover. It's minimally invasive because by pressure of the balloon, as opposed to removing the tissue, it's opening up the sinuses. So it's not as painful.
So doctor, how do sinuses stay open after balloon sinuplasty surgery?
It was surprising to me because I didn't believe initially that it would work, because we are taught you need to make a nice big opening and that's how things stay open. But the balloon, the sheer pressure of the balloon maintains the patency of that hole, and I go back and I check on my patients and I'll look up there and yes, sure enough, that opening is still there because it's just what we call a pressure necrosis. So the sheer pressure of it has opened that sinus, and that remains open unless, of course, you have more infections or polyps or growths and things that will actually occlude and block things off again.
Doctor, you've led Northern LA County and Southern Kern County in technology with laser lipo, with fractional CO2, and now with balloon sinuplasty. You're the first to offer this.
I am, and it's a nice alternative for my patients. They don't have to go all the way down to Los Angeles to have this procedure done. So it's very convenient. And again, it's minimally invasive, minimal downtime. So it's a nice option for my patients.